I'm the boss. At my work, I'm the boss, not at home. That's why I go to work, so I can remember there's something to listen to. So I'm Dr. Grant Fourie. I'm a general practitioner that practices here in Bellville. Are you guys from all over Cape Town?
Yes.
And the Western Cape? And Africa? How far up does this extend, this group of people? So if you don't know, we're in Bellville, not too far from, about 10 minutes from here. I'm a general practitioner with special interest in something we call functional medicine. Just to give you a bit of background of what we do, functional medicine is an emerging field of science. Has anybody heard the word functional medicine?
Medicine.
Medicine's good. You're aware of Dr. Oz?
Yes.
Dr. Oz is about the closest media person I can relate to tell people about what functional medicine is about. It's about explaining to people what's wrong. It's about trying to find cures for disease that are not medicinal, not medical. So it's a chronic. It's a type of medicine that focuses on chronic disease with the aim of not treating only the disease, not suppressing symptoms of the disease only, but actually finding the cause of the disease, the original cause, identifying that as accurately as possible. We work a lot with timelines. We go right back into people's pasts, so as far as into their pregnancies, their mothers, their parents' history, the environment in which they work, and we try and find when did things start to change, what was the trigger, what was the cause, because we have a strong belief that, this is very different from what all of us are taught, we have a strong belief that if you give a medication that makes a symptom go away, you haven't necessarily solved the problem, you've just made it go away. And so any of you, if you ever break your arm and you go into the doctor's room and you say, "Doctor, I've broken my arm, can I have a cast to stabilize my arm so it can heal?" And he says to you, "No, don't worry. I've got this injection that takes the pain away. It's a local anesthetic. So I'm going to inject that into your arm, then you'll be fine." And most of us would be a little weirded out by that. We would immediately go, "That doesn't sound right." But somehow when we go to a doctor and he says, "You've got sugar and I've got a pill that will take it away," we go, "Awesome." And nobody ever goes, "But did that fix it, or did they just take the problem away? Does it look better? Have I numbed it? Have I tricked my body or my brain into believing that something is now better that actually is not better anymore?" And there's what's happened over years and years and years of practicing medicine the way we all have been taught, modern medicine, is that we have hundreds of thousands of people on chronic medication, which you guys see every day, and they're not necessarily living longer, they're not looking better, they're not healthier, the heart attack rates are high, the mortality is high, hypertension is high, cholesterol is high, people don't use their medication, compliance is poor. So we have this huge problem, we throw millions and millions and millions of rands at it, we don't really solve the problems though. And a lot of people seem to think that if they take a pill which manages the sugar, then they don't have to live like diabetics, so they just do what they want. And the same with cholesterol. And the same even for blood pressure, or what we're going to talk about today. I've got the topic of the Gastro-oesophageal reflux disease, GERD.
Wow.
Really? Is that the hard part? No, you've got to learn that one. That's the part you have to know. So this is functional medicine. And wherever I go, I challenge people who have contact with patients like you, where people are asking you stuff, like you know stuff. Do they ask you stuff like you doctors?
Yes.
It's amazing what people expect of people who work in pharmacies. You know, even the cleaner is expected to know something about vitamins because they work there. Now they must absorb this information. So for me, it's important that you guys, you're seeing so many of the patients that never end up with us, and you're giving a lot of advice, and you really have such an opportunity to hear what that person's saying. You've only got a few seconds or minutes to do it, but to hear if this is something that just a medication can solve temporarily, or if this is a bigger problem that really should be dealt with properly. And properly doesn't mean stronger medication necessarily. Properly means thinking bigger about what's the big picture of this problem and trying to direct that person to the right type of doctor to help them that will actually get rid of the cause instead of just numbing the pain. So that's functional medicine. It's big. It's one of the fastest growing forms of medicine in the US at the moment. It's very big in the UK. It's very big in Australia. It's lagging over here. but it's very much coming. So over the next 10 to 15 years, you should be hearing the word functional medicine more and more. The word you're more familiar with is integrative medicine. That people are starting to know about. You might know about anti-aging medicine. I've heard those words before. And functional medicine is sort of taking over a little bit from those because it's a lot more science-based. So it's real doctors, real medical people that are applying a science in a functional, holistic way. Holistic, not like we're praying for people. Holistic, like the complete person. And the idea is to return to full function. And we will use whatever is scientific to back up what we say. If you come and tell me that by shining green lights in your eyes at a rate of 10 flickers per minute is going to cure your arthritis, I'm going to want to see the science involved in that. Okay? But if you can show me there's science, and you can show me you did a study of 200,000 people, and it was true in half of those people, I'm going to be a bit more interested. So I need to know it's repeatable. I need to know it's sustainable. I need to know that different people in different places can get the same results. That's the science we're looking for, evidence. We don't want to guess. We don't want to make stuff up. We don't want to be quacks. That's what a quack is. A quack just says something that makes him sound good, but doesn't really help the person. And I think a quack also doesn't help a person. We want to help people permanently. We want people to live longer and better. We don't just want to take their problem away for now. But tonight's thing, after that whole speech, tonight's thing, this afternoon, morning, we're just going to talk about taking your pain away. Okay, so, but I'm going to show you how we approach this thing from a functional perspective. So, when I was asked to do this talk, the company that asked me to do it said, please tell these nice people about Gord and tell them how to sell Gaviscon. Are we allowed to talk about products? Okay. I did mean to check yesterday too. So, Gaviscon sponsors me to come and do this talk. So, they want me to tell you how to sell lots of Gaviscon, why it's so awesome. And I will show you why it is awesome for the right person at the right time. Because I think that's also something we all want to know. There's lots of different options and choices when people come to you with complaints that sound similar. And we want to know which one is the right one for the right person. Which one is safe? Which one is safe to use for a short time? Which one is safe to use repeatedly? Which one is safe to use for 10 years? Because you know you have those patients that come into the pharmacy that have been on something over the counter for years and years. And if you ask them, when last did you see a doctor about this? I don't need a doctor. This works fine for me. This works fine for me. And this stuff has a massive place, and it is a very important product. So the word we're using here, sorry, let's get this fired up. There's the Gord or the Gord. So it's the same word. It depends in which country you live. So in the UK and in South Africa, we talk Gastro-oesophageal with an O. But in America, they spell esophageal with an E. So they talk about esophageal. It's the same condition. Gastro-oesophageal reflux disease. And what that means, really, it's the people that are coming into your pharmacy and they're complaining of heartburn. So it means there's acid in the wrong place that is causing them discomfort. And the acid generally that we're talking about in Gord is not the acid in the stomach. It's not an ulcer. It's the acid that is out of the stomach, normally in somewhere between the vocal cords and the top of the stomach. Okay. There's a difference. We'll talk a little bit about how it works and how you get it, because there's a thing here about regurgitation. Sometimes you will cough up a little bit of food and swallow it again, but that's not reflux. That's not acid that's spending time in the wrong place. That's just food that's struggling to find its way down to your stomach. Right, so I wanted to show you this first, so you just kind of get a picture in your mind of the stomach, because I'm going to refer to different parts of this as we go along. The top of the stomach is bordered by the muscle under the lungs called the diaphragm. Not a very strong muscle, which we use mostly for breathing, so it hasn't got much to do. But very importantly, the top of the stomach, the esophagus and stomach meet roughly where the diaphragm comes together. And so the diaphragm forms part of a valve system that helps the stomach to keep the stuff that should be in the stomach, and the stuff that shouldn't be going up in the stomach. It's not a valve with a flap that opens and closes. So we talk about a functional valve or a sphincter. It doesn't flap open and closed. It squeezes open and closed. It's designed like that very cleverly so that things can go both ways. And it has saved many people's lives over the years by allowing us to throw stuff up. Vomiting, which is absolutely critical to the survival of any creature. So that's your esophageal sphincter. Then you have the stomach, and at the bottom of the stomach you have another one of these valves called your pyloric sphincter. And this also is a functional valve. There's no flap, but it's a very strong muscle that decides how fast food should flow out of the stomach again. So basically it's deciding if the stomach content has been digested sufficiently to be allowed into the digestive system, the small intestines, where you can't really tolerate big molecules. So the stomach itself can handle really big chunks of stuff. That's why you can take a bite of an apple, take 2 bites and swallow. And that'll be fine. The stomach will sort it out. But those 2 big bites of apple can't manage the same if they get into your small intestine. So that's the filter system to make sure that what's going here is small enough for the body to digest, because that's where all your enzyme digestion starts to happen. So the only process that happens in your stomach is the breaking down mostly of fats and proteins under the action of acid, and an enzyme called pepsin, which the stomach produces, which also works on the proteins. And what happens is that the food is broken up into what we call macronutrients: carbohydrates, proteins, fat. The vitamins and the minerals also start coming loose and free in this process. But that's the main role of the stomach. It's a very active region, very, very active. If you see what your stomach is doing, it's actually amazing that we can't feel what's going on over here all the time. And if you understand how active it is, you'll also understand how this reflux happens. All right, so acid should stay in this area only. The stuff that's going out here is acidic for a very short space of time, and in this section, the duodenum, the gallbladder, sprays bile onto the food, and that changes it to alkaline. So that's the opposite of acid. Remember, acid is pH is small numbers, alkaline pH is big numbers. So alkaline here, acid here. Over here, slightly acidic, but much less acidic than what's in the stomach. Right. I want you also to think of the stomach as a pipe, a continuous long pipe that starts at your lips and ends at your other lips. It doesn't stop. It's a continuous pipe with no valves. It just goes. So this is a very, very important consideration when you listen to your patients explaining what's going on with them. Because pipes have a very unique way of functioning because it's continuous. Imagine if you stretched out, it's about 9 meters of pipe. Take your hose pipe at home, if you're watering the lawn, and the water's spraying out wonderfully, but then you put your finger over the top of the hose pipe to stop the water flow. Then, while you have your finger over the top of the spout, the water starts spraying out at the tap on the wall. Now, where is the problem in the pipe? Logically, really a 2-year-old could work that out for you. The problem is not where the water is spraying out the tap. The problem is where the blockage is in the pipe. But you would think that's logical. But how many times when somebody complains of an ulcer or stomach cramping or heartburn, do you ever think that this is part of a pipe? And just because this is where the symptom is, doesn't necessarily mean this is where the problem is. So that's the concept I really want to show you. This is functional medicine. Functional medicine says there's a flow problem in the system. The body is reacting negatively to something somewhere in the pipe. The most obvious symptom you can feel is burning, because you can't feel movement. You can't feel the stretching of your stomach. You can feel a spasm in your intestines. You can feel pinching of your intestines, but you can't feel movement in your intestines. And your intestines have to swell really a lot before you have a bloated, cramping feeling. A lot. You can feel constipation. So you listen to what do your patients who have stomach problems complain about? They complain about heartburn, cramping, and constipation. That's what they're coming to get from you, something to get my tummy going. It's an interesting concept because sometimes to treat somebody's heartburn, they might just need to go to the toilet and have a good bowel movement because their constipation is blocking the end of the pipe. And the body is brilliant in how it tries to resolve the problem higher up in the system. So what can happen is that your stomach perceives there to be a problem in drainage. So your automatic instinctive reaction by your body is to stop the input while it struggles to deal with the output. You've all had diarrhea at some point in your lives. So we don't have to stick up hands or tell the story. How many of you noticed at the time, very frequently when you have diarrhea, you're also nauseous or you have no appetite? Don't feel like food. If you're very unlucky, you throw up as well. But why is that? Is that because the germ that gave you diarrhea made you nauseous as well? Not necessarily. E. coli, yes. That bug makes you nauseous, throw up, and diarrhea. But many times what happens is the infection is in the intestine. The body realizes here is a big problem, and its instinctive way to stop you from making the problem worse is to make you feel nauseous so that you don't put more stuff in until the problem's gone there. So gastric stasis, when the stomach stops moving, you experience that as nausea. So a lot of tablets that you might give to your patients also have the side effect of nausea. Champix. Have you heard what the people complain about with Champix? Nausea. You know why? It stops their stomach emptying. That's the only reason. It doesn't do anything in the brain. Their stomach doesn't empty. So they feel full. They feel uncomfortable. They have a sort of an indigestion because the stomach stops moving. Gastric paresis is a fancy word if you need fancy words. So that's interesting. Hey? Important to understand how this pipe works. All right, let's look a little bit about what reflux actually is. So you have the esophagus, and you have the contents of the stomach, including acid. Bile. Bile is what your gallbladder is secreting. Now it's interesting that we include bile as stomach contents. We've all had that experience where you throw up, and you throw up, and you throw up, and there's no food left, and what do you start throwing up then? Yellow-green fluid, bile. So bile, although it's in the small intestine, in the duodenum, can move backwards up the system as well. Very important, because bile burns. And if you remember from what I told you earlier, let's actually just go back to this picture. Bile is coming from beyond the stomach, where it's alkaline, not acid. But it does burn. So if any of you have ever, really lost your minds and licked the soap in the shower, you will notice that it's not very pleasant. And you will also notice, you're going to have to imagine this because none of us have ever done this since we were 2. But it burns. Your granny is always going to wash your mouth out with soap because she knows it burns. But it's not acid, it's alkaline. So somewhere in our minds we think acid burns and we think alkaline doesn't. But you do get an alkaline burn. It stings. It's an unpleasant taste. And you get people who have this. And that's very important because by giving them an antacid tablet, you're actually not helping them. Because it's not acid that's burning. It's bile. Right, so let's look at this picture. There's some little things that we add. So that essentially, the acid that is in the stomach is coming up the wrong way and spending too much time in the esophagus, somewhere between the vocal cords and the stomach. An interesting thing, though, is that it is normal to reflux. We all reflux. Partly because the stomach is so active, partly because we always overeat, partly because we eat and drink at the same time, partly because we eat and drink too much and go to bed and lie down. So all the things that work against the way that valve is working just drop us, because that poor valve just can't fight against all these different things that are happening in the stomach. So acid comes up and down all the time. That's an important thing to know too. So basically this little diagram is just showing you that from the time that you eat, you can start having refluxes up to 42 times an hour. Acid will come up and down, up and down. But your esophagus is a super protected organ, and it doesn't burn immediately, so you don't feel it. So some people can have heartburn. No, some people can have reflux without heartburn. But I'll show you now that some people can have heartburn without reflux. Do you get the two sides of that? Or just to keep it interesting. Okay. It happens more at night because that's when we're lying down. So this valve is very gravity dependent. It needs food to go down. But the pylorus at the other side is a much stronger muscle. So it's preventing the food passing out. So up is always the least resistance. All right, what else do you need to know? It's normal to reflux. 42 times per day is normal. Majority of reflux occurs in the first 2 hours after eating. Majority of reflux episodes are not associated with symptoms. And so here's the thing that gives you the symptoms. Who moves then from 42 normal times a day to 42 or more times and starts to hurt from it? So when the stuff coming up is very acidic, when it comes up too high, when it comes up repeatedly, when there's a lot of bile or pepsin, we'll talk about that still, when the esophagus is just burnt out because it's happening so much over so many years, it eventually just can't resist it anymore. Happens a lot, to said that one. A hiatus hernia, I'll show you what that is, and others. That just means we didn't have space. It's normal to reflux, but the problem is not necessarily too much acid. So very, very few people actually have too much acid or acid that is too strong. The pH of your stomach contents about 2.4. So that's pretty acid. If you ever work with acid, the acid you're putting in your swimming pools is also about 2. It burns stuff. You can melt through metal with your acid. It's not something we need to do very often, fortunately, but you get a cool cape and you get called Acid Man. That's an awesome superpower, I think. So very few people overproduce acid. They're called Zollinger-Ellison syndrome. Very, very, very few people. In fact, I've been a doctor for nearly 20 years and I don't know if I've ever seen one. You just don't see it. So the problem is not too much acid. The problem is that the acid that you have is in the wrong place for too long. Okay, so that's an important thing to say. Because a lot of people use that word, I have acid, I'm acidic, I have too much acid. They don't. They have movement problems. The acid's not going the right direction. What else? Acid can reflux, pepsin can reflux, and is volatile. Now, volatile means it's a gas. So people can burn from pepsin gas that is floating up the esophagus. People that arrive and talk about laryngitis, they wake up in the morning, they can't speak. They have a postnasal drip, a cough, a clearing of a throat. They typically wake up in the morning like this. But you ask them, do you have heartburn? Well, no, not really, but yes, here, or really far away from the stomach. So the acid hasn't come up all the way there, but their pepsin does, because it's volatile, it's a gas. And that's very important again, because I can give this person with pepsin Nexium till it goes out of fashion, which the company will prevent. But you can give them very strong antacid medication and it won't help them. And you've seen these patients. Do you see these people that come and say, I take my stuff every day, but I still burn? You know who else complains of this, interestingly enough, is people who have the operations to fix their heartburn. They have a procedure, we haven't got time for that, called a Nissen procedure, where it stops the acid coming up. They tighten the valve, essentially. They still burn afterwards because of the gas now that can still come up and down through that sphincter. Interesting thing. So you can have reflux without burning, and you can have burning without reflux. Very important. Why does your stomach not empty properly? There can be delays at the pyloric sphincter. If the food is not digesting properly, then the pyloric sphincter can't let it through. Food that empties out too slowly, kind of the same problem. So that might have something more to do with the type of food you've eaten. If there's something wrong with the food, your sphincter will shut And so that's typically when you go to Kentucky and an hour later you go, ooh, something's not lekker. And then you check out the window of your car and you sort it out. Hopefully while you're standing somewhere on the side of the road. Or after those busy nights where you're out there enjoying your friends, being irresponsible. Not you guys, that's now the other people in the world. Bad people. Not us, of course. And reflux of bile can burn too. What else? Is it only acid that burns? No. Oh, this... No. See, I really wanted to emphasize that. No. So you're going to remember this part? No. Bile reflux is alkaline causing alkaline burn. Here's another very interesting one. Hypochlorhydria. I know you've never heard that word. There's another condition called achlorhydria. Hypo is probably more accurate. Hypo means low acid secretion. Achlorhydria means no acid secretion. So, low acid secretion causes the stomach to stay full for long because the food that's supposed to be breaking down and digesting in the stomach can't, because the stomach either doesn't produce enough acid fast enough, or the acid that is being produced is not strong enough. Okay? Hypochlorhydria. And look who gets this. People with low thyroid function. So all your patients who come to you on thyroid medications. Old people. Medication like, here's the real joke, like medications that we use for heartburn, like the PPIs specifically. So what the PPIs do, what are the ones you know? Altasec, Omes, Nexium, all the new ones, Trustans. Those things are taking your pH of 2.4 and they're raising it to 4 to 4.5. In other words, they're making the stomach content less acidic. But now the food takes longer to digest and doesn't even digest properly because the acid that was so important to break it down is weak. So it spends a long time in the stomach. You know what these people complain of? Bad breath, discomfort after meals, burping. So what happens is there's a fermentation process that starts to happen in the stomach. There's a lot of gas production, and they typically are burping after meals. Uncomfortable. They go to bed feeling full. They have small portions, but they feel full, like they've eaten a plate full of food. Helicobacter is a little bacteria I'll show you. No. And then radiation. People that have radiation therapy, cancer patients, they have slow stomach moving. So you know chemotherapy patients. What do we all know happens to chemotherapy patients? They start throwing up and they lose their hair. But the chemotherapy interferes with their gastric emptying and with their acid production and with their processing through their tube. What else? This is Helicobacter pylori. So recently to be released, soon to be released in a major motion picture. This is very hard to say. I should have practiced that. Soon to be released in a major motion picture called Return of the Helicobacter pylori. This is a little bacteria that lives in your stomach. The interesting thing about a bacteria that lives in your stomach, you would think it likes acid. And it does like acid, but it doesn't like the acid as strong as we make it. So it tends to burrow a little deeper into our stomach lining to get to where the acid is just not quite as strong. But this burrowing effect causes a problem because Helicobacter you don't find 3 or 4 swimming around, you find 3 or 4 billion swimming around, all burrowing to get away from the acid, and they form ulcers in your stomach. So when people come with ulcers that aren't going away, aren't curing, their symptoms are controlled. This is a very nice example of the person with a broken arm. I've numbed the pain. Now don't worry, everything's fine. But as long as this guy is still active in your stomach, it's burrowing away at your stomach. And just because I've changed the acidity doesn't mean I've fixed the problem. It means I've numbed the pain. And he will eventually go on to cause your stomach cancer, from which you will die while you take your Nexium and feel awesome. So, very important little bug. We can control it by removing the symptom, but that's not what we're wanting to do. So all these medications we give sometimes are just making you feel better without fixing. And the last part of this is just how do we get rid of it? There are a few ways we can get rid of this bug. We can give an antibiotic, very simple antibiotics. Classid, amoxicillin, kills this bug. You often see that combination of Classid and amoxicillin. That's to kill this guy. We can give something called mastic gum. Now, if any of you have ever ventured beyond the counter to the dark side of the pharmacy, you know, where you actually make money, they sell something called mastic gum. Solgar sells it. Solal sells it. Some of the natural medicine people sell it. They? So there's quite a few people. There's quite a few.
Is that binding?
It's called a gum. It's from a plant. It's a gum from a tree. So it's not something you chew. It isn't bubble gum, mastic bubble gum. That would be awesome too. But this is a tablet which suppresses the growth of this Helicobacter. We have also something called zinc carnosine that you also find, not zinc, it's a zinc carnosine, it's a specific form of zinc that also suppresses the growth. Now zinc has a lot of antibiotic properties. So if you have patients with diarrhea, have you ever been told that you can give them zinc? If you have patients with acne, you can give them zinc. If you have babies with nappy rash, you give them zinc. So zinc has a super antibacterial action, very similar to silver. But zinc, very, very cheap, very available, very harmless. And so works very well, even for the heartburn, funny enough, but probably because it's suppressing the action of this and returning the acid to normal, but in a natural way. Right. So that's functional medicine, that's the pipe, that's the causes of acidity. Let's look at the sphincter now. This is the diaphragm, this is the top of the stomach again. And we're just going to look a little bit again at the acid coming out. I'll move through this quite quickly. This is the junction where the acid, the stomach starts, so it's a little bit below the valve. The LOS stands for lower esophageal sphincter. And we now know that it's not effective, so I kind of think we've done this part. I just wanted to show you a hernia. You guys heard of hiatus hernias? Do you know what they are though? So just very quickly to remind you then, the stomach belongs below the diaphragm. The valve above the stomach is very dependent on the diaphragm helping to close that valve, to keep those contents here. As soon as something disturbs it, that valve can't close properly anymore. Now nothing stops the reflux. As soon as the stomach pulsates or pumps, food will go up and down. So these people experience lots of pain. And then you get one where the actual stomach can slip up next to the esophagus and can cause burning. These people typically will tell you that they feel the food is stuck. They have to drink something to get it to go down. Or they can throw up food that's not even really digested yet. So this valve sometimes will go into a spasm and it will prevent the food even coming now into the stomach. Causes all sorts of problems around it. These are the ones that generally get operated on. But another important thing about this is we all have this at times. Up to 60% of us will have this with no symptoms. And it will go away again. Many pregnant women will develop this while they're pregnant. It will go away again. Overweight people will develop this. If you lose the weight, it will go away again. So it's not something that once it's there forever. So these people don't all need surgery. We've talked a little bit about the different things in the stomach that come up, bile, pepsin, acid. So I think this is really just a repeat of some of the things that have been said. There's a cool word called refluxate, if you just need a cool word. That sounds a bit like naughty. And say, get the refluxate out of him. Because that's the stuff that's coming up. The contents of the reflux is the refluxate. This is what happens if you put a camera down the throat and look now. We're looking at the top of the stomach, so not into it yet, that lower esophageal sphincter. So this is the bottom of the esophagus. Right through that hole will be the stomach. This is the lower grade gastro-oesophageal reflux disease symptoms. And that's kind of normal. Notice that it is a little bit red already because there's always acid there. That's the junction that we showed you in that other picture. That's where the cells start to change to stomach cells. And this is when it's a bit burnt. This is when it's been burning for a long time and it starts to become deformed. Metaplasia is early cancer changes of that part of the esophagus. And then you get proper cancer, where you end up with these people dying very slow, painful deaths, not being able to eat. They often have the entire esophagus removed. They suffer for long periods of time. Fortunately, we don't see this often anymore because of the gastroscopy. So people are having the camera exam. But you know who does get this? The guy who's been coming into a shop buying antacids for years without seeing somebody about it. And that's the challenge for you guys. How long have you been using this stuff, sir? Does it work? Do you need to keep using it? How many times a day? Because if he's using it more and more, and he's buying it year after year, something's cooking. And he's going to get caught out. By the time it's there, hey? The esophagus is cooking. It is cooking. And over here, it's well done. So, he hasn't got long to live, this guy. He hasn't got long to live. I think they talk a bit about indigestion and heartburn and the difference. So really, indigestion means the stomach's not emptying. Heartburn means the stomach contents are coming up, if you need to distinguish between the two. I don't know if everybody knows that. Well, I think we generally all get that it's in two different places. The burn from heartburn can feel like a chest pain that mimics a heart attack. So often we'll see these patients in the casualty units late at night, panic attacks, high blood pressures, high pulse rates, can't breathe, think they're going to die, chest pain central, goes down to the arm. You've seen these people. Best you send them for an ECG and have a look. Don't say, oh no, I've got Gaviscon. I can't remember if that's for reflux or for heart attacks. So try it first, and if you don't feel better in the morning, no, if you're still alive in the morning, then go and see your doctor. So we've got to be careful. It does mimic the two. Fortunately, the pain and the symptoms of heart attack caused by this are very common, and the pain caused by the actual heart attack is much less common. So you, half the time, will probably be right to give something for acidity. Just make sure your insurance is paid up, that you've got a place to hide out for a few years, or that you get Oscar Pistorius' lawyer. And then you'll be fine. You see, now I've immediately dated this video by trying to be current. I do apologize. No, we can't use it next year because you're not going to remember who he is in a year's time, eh? Let's be honest. Unless they have that prison athletics program still running. Okay. Who do we use our products for? Let's get into Gaviscon specifically. I've got to wrap up in a few minutes. So pregnancy, this is probably still one of the safest products for our pregnant ladies because it's not absorbed into the system. It remains in the intestines. It's not affecting acid secretion. It's not affecting the emptying of the stomach. It's just affecting acidity of the contents of the stomach. Very safe for them. It's fine for the lady or the guy who've had a night out or you've had some spicy food. You just want to, you've hurt yourself. You have overdone it and your stomach is a little bit raw, gastritis, and you are refluxing more than normal or oversensitive to the reflux. So normal reflux, just more sensitive, perfect for these people, just to have in the cupboard, too much alcohol and stress. What about the different types of remedies you can give people? So what are the options you can give? So we know that you can give antacids like Rennies and Gaviscon. Forget I said Rennies, just think Gaviscon. Okay? Just perfect. Then, in fact, it's in the lecture there. Thank you very much for coming. Do you want to know more? Okay. So these companies haven't paid me anything. H2 receptor antagonists. This is a very old treatment we used to have. You know, still maybe Zantac, and there's hundreds of generics of these products. You can buy it over the counter now. Tagamet and Zantac were awesome when they were launched probably 25 years ago. They work in the stomach and they reduce the acid secretion by 63%, 65% is the stat there. And then you have the group that has taken over, called the PPIs, Nexiums and the Losec and the Landcaps and Lanzalox and those guys. And they are very effective at reducing acidity And because of that, they are very effective at reducing the symptoms related to acidity. But from what I've told you today, that doesn't necessarily mean we've helped these people. We've just taken their pain away. Specifically and importantly, none of these things stop reflux. So here's another important thing. You still reflux. You just don't feel it. Your stomach still doesn't empty properly. You just don't feel it. If you look at the pros and cons of the different stuff, PPIs interfere with other medications a lot, and there's some other things I'll show you about PPIs. But the fast-acting things, the Gaviscon just is really safe. It's fast. It lasts for a couple of hours. It's safe for pregnant women. It has no interactions with anything happening in the body, and it has no. That's not entirely true, because I wouldn't tell somebody to take their Altroxin with their Gaviscon. Do you guys know about stuff like that? Altroxin, you must ask your patients on thyroid medication. Different conversation. They may not use these products because the calcium carbonate binds to the Altroxin, and they end up having symptoms of low thyroid again, even though they're using the tablets every day. So no PPIs and no things that change acidity with Altroxin. This is a little test that they just showed us. Over 4 hours, people were given 3 different treatments. They were given nothing, they were given Gaviscon, they were given Losec, they were given Zantac. And you see initially the Zantac and omeprazole groups did very well. The Gaviscon in the first hour did the worst. But hour for hour thereafter, you'll see the Gaviscon quickly came up, whereas the others started dropping off. But by the 4th hour, there wasn't a massive difference between them all. So, you know, our patients aren't always patient to wait for 4 hours, though, are they? Because they want the one that works now. And you know how you can get the one to work now? By trying to identify the reason for the pain. Because if you've got the right reason, you'll give the right treatment, it will work fast. Why not just give everybody Lanzaloc then? You guys can give Lancap 15 milligrams, no? And what do you secretly tell the patients? Nobody knows this, but sometimes you say, you can take 2. Do you even whisper that anymore? Do you just say it now? Hey? You don't say that. Do you not dispense at all? Are you just in the back picking off the shelves? Are you innocent bystanders? Really? You don't see patients? Never. Why? So, this is what happens. The Lanzaloc, for example, dose is 30 milligrams. You can go up to 60 milligrams. You can buy 15 milligrams from the pharmacist, but 15 milligrams is a maintenance dose. It's not going to help for acute pain. That patient needs to take up to 4 of those 15 milligram tablets a day to work. Nexium as well. You can take 2 a day to get it to work. But what happens with them? If you are on these products for long periods of time, more than 3 months even, we start to see problems with absorption of B12. We see problems with absorption of iron. Problems with the pH always being too high. In other words, not acidic enough. Potential decrease in the immune defense provided by the acid. Because remember, what's your acid doing? Everything that drops into your stomach is killed. Funguses, parasites, flies, worms. I'm trying to be multicultural. What are bats? I know, right? People could eat bats. So who ever swallowed a silkworm? Nobody? Did you put them on your tongue at least? You see, you haven't lived. Okay. So, your acid is a super, super important barrier against infections coming in from the outside. And here's another big problem, a very interesting thing that's only recently been discovered and not even broadly accepted. But what we see happens is, when I give you Nexium for a long period of time, your body has to get used to having acid levels that aren't strong enough. So it tries to compensate for the problem by making more cells that make acid. So now it really tries to up that acid. But the Nexium stops it from happening. So what ends up happening is that when that patient one day decides not to take his Nexium, he really burns. Because now he's got 100 cells making acid, where before he only had 50. And you know what ends up happening is they end up taking those products for year after year after year after year. And you fill those scripts out, you know what they look like. Chronic script, blood pressure, cholesterol, antidepressant, sleeping tablet, Nexium. Yes? Yes? They might as well just print them out. Hey, why do doctors even write those things anymore? I should have a stamp. Standard. Absolutely. Anyway, so PPIs solve pain but don't solve problems. Gaviscon solves pain and prevents problems. That's the big difference between the two. It's always going to be a safer thing to give something that just relieves symptoms. And to get off of it as soon as you can too. How does it do it? Last few minutes. It's a sodium alginate. It's made from seaweed. It's a gungy stuff. Have you all had a chance to try it? Some people don't like it. The old flavor was like an anise seed flavor. People don't really love the anise seed. The new one's got a different flavor. It has sodium bicarbonate and calcium carbonate, and when it falls into your stomach, it mixes with the contents of your stomach, it mixes with the acid, and it starts to form a little bit of a thicker gel, which is filled with carbon dioxide gas, and that makes it start to float up to the top of the stomach. So you guys have seen that demonstration, they fill their little stomach. I have it, just in case you haven't. One of my patients asked me if this is my bong. So I was... That's why I haven't used it. I thought, well, maybe. We'll see how that works out. Okay, so we know it works very fast. It works for the pepsin. It works for the reflux because it forms a seal on top of the stomach. So it's an awesome way to fix the problem. It's forming a very weak but a very important valve. And some of that calcium carbonate is mixing with the contents of the stomach, and that's making the acid less burny. It is increasing the pH. So a very clever way that it works. Everybody should have it in their cupboards at home. This is the seaweed. Fortunately, we don't have it in that form anymore. Imagine just go out to Big Bay and you just help yourself right off the beach, eat all you like. This is a CT scan of somebody lying on their side. They've got some chocolate milk in their stomach, and then they drink the Gaviscon, and what happens after a few minutes is you can start to see it forming that layer on top of that stomach contents. This was just a little picture showing that the patient's pain relief increases week for week just using Gaviscon. The placebo means they were just, positive thinking and milk. Their pain... Also, interestingly enough, always interesting with placebos that people get better. Hey? Anyway, one of the things about functional medicine is we often are more interested in this group that got better on nothing. Because I want to know, why did you get better just because you thought you were getting better? If I can find out what that is, then I can make everybody better. So, the safety we've talked about. This is a little... I don't think we really have time for this. But this is how they measure acidity. They put a little probe down your throat, and basically it tells you what the acid is at different levels coming up the throat. So that's how we can measure all these things that they've done about how acidic are you as you come up. We don't do this a lot. It's a very uncomfortable test. You have to walk around this for a few hours. It's expensive, but they get these kind of results from it that basically show how the acid is in the lower part of the esophagus before you take something like Gaviscon and after you take Gaviscon. And with all those squiggly lines, you can imagine the only reason I'm showing this to you is because obviously Gaviscon looks cool in this. It works. It makes it a lot less acidic. Okay. But it really does, so it's not like I'm making that up. This is just a little slideshow of what's actually happening. So this is a meal that's been eaten, that's been stained with something technesium, which makes it green. And then a little while after, the patient swallows the Gaviscon, which is now red in the picture. And you'll see that it mixes initially, then starts to float up to the top of the stomach contents where it forms the raft. The stomach continues to digest and empty out. Notice how full the stomach still is 2.5 hours, 2 hours, 20 minutes after you've eaten. It's very full still, hey? So food takes a long time to pass through your stomach. Remember, we can't feel it. But you can have food in your stomach for up to 8 hours after you've had a meal, if you've combined fluids, solids like fats and proteins, and carbohydrates in one big meal. And there eventually you see the Gaviscon going through. So that's basically my story. This is just a really summary of stuff we've talked about. It works in a different way. It works awesome for the right person. It's a safe product to use. And PPIs are not always the answer. If you've understood everything, then you can become doctors now. Of that part of the body. It's a specialist field. Gordologists. It could catch on, I don't know. So good luck to you. Enjoy what you do, make a difference, and try and change people's lives. You have a chance to do it by thinking about what you're doing, which is hard in a pharmacy. Because you just have stuff in front of you all the time. And sometimes you forget what you're doing and how much it can impact the life of that person that you sometimes don't even see. But it's an important job that you guys do see. Thank you. Thank you for your attention.